It's me, Bobbi Brown.
Hey, what's up? I'm Kelly Rowland.
Hi, this is Chelsea Clinton, and you're listening to me on That Total Mom Sense.
This episode has been brought to you by Skin by Dr. Simran Sethi. Dr. Sethi is an internal medicine doctor with over 17 years of experience treating patients on a clinical and aesthetic level. Her skincare line is created for women of color, and as a South Asian American, Dr. Sethi strives to solve their most common skin concerns and bring out their skin's natural radiance so they feel even more beautiful, glowing, and confident. I personally have done numerous treatments to treat acne scarring and hyperpigmentation, and especially love the brightening system, which includes an Ultra Glow Moisturizer, Vita C Restore Serum, Hyaluronic Pump and Protect, and Skin Renewal Polish and Mask. I also love the Retinol Lipid Complex, which is a highly potent, rich and gentle 0.5% retinol and glycolipid combination that promotes long-term skin renewal and diminishes fine lines, wrinkles, dark spots, and overall dull and patchy skin. Heal your skin from the inside out. Log on to Skin by Dr. Sethi, SETHI.com, and use my promo code MOMSENSE20 to receive 20% off at checkout. That's MOMSENSE20 at skinbydrsethi.com. As a South Asian American and woman of color, I've personally found it to be very difficult to find skincare treatments and products that are safe and effective, and have done a ton of research and trial and error over the years. From my teens, when I had acne-prone skin, I've been on deoxycycline, minocycline, which actually turned my skin blue. I'm not kidding. Accutane, and in my 20s and 30s, have done numerous in-office procedures, including microdermabrasion, Fraxel laser, chemical peels like VI, glycolic, and lactic acid, and have been using Retin-A before and after my pregnancies. I can't tell you how honored I am to have industry expert Dr. Simran Sethi join me on the show today. We're going to be talking about her journey and how she went from internal medicine to skincare, and how we can take care of our melanated skin and the best way to achieve long-lasting results. We're also going to be debunking beauty myths, talking Ayurveda and nutrition, and how to stick to simple morning and evening skincare routines. Dr. Simran Sethi, MD, MBA, has 2 decades of experience treating patients on a clinical and aesthetic level. She has cultivated her skincare line by focusing on both how the skin is impacted from the inside and out. Her line of products, called Skin by Dr. Simran Sethi, includes her signature brightening, hydrating, and acne combating systems, featuring ingredients like glycolic acid, hyaluronic acid, green tea extracts, vitamin C, and retinol. Her med spas, RenewMD Wellness, are located around the San Francisco Bay Area. And because she's so one-on-one with her patients, you have got to listen to her podcast, The Skin Report, where she uncovers trends and gives advice to her listeners each week. She also happens to be a mom of 3. So we're going to talk about her parenting journey too. Dr. Sethi, welcome to That's Total Mom Sense.
Thank you so much.
It's a joy to have you here. I can't wait to dive in.
I was really enjoying your summary of your journey. So yes, I can't wait to dive into that too.
Thank you. Well, let's start with your childhood. I feel like we have something in common. We're both South Asian and of Punjabi descent. Oh, what was it like growing up for you?
Well, my parents migrated to the United States, and I was the oldest of 5 kids. When you're the oldest, you're meant to be an example to your siblings, and your parents are probably a little stricter with you than they are with the rest. And you don't realize that until your younger siblings grow up and you're like, what? You let them do that? But we were lucky that we had family around. I grew up in the Midwest in the St. Louis area, and there weren't a lot of people who looked like me. So the small group of people who did, we were very close-knit.
And are there any traditions that you had, or any Banju sayings or dishes that, you remember fondly?
Because my parents were both working, we did a lot of experimenting in the kitchen by ourselves. So we had a lot of fusion. We'd mix a lot of Western ingredients or dishes with Eastern. I had a tendency to mix lentils and everything. My siblings and I would eat our meals in the wrong order, like breakfast for dinner and
Okay.
vice versa.
That's
But so
awesome.
I miss that. But, when you grew up in the Midwest at the time that I did, we adopted a lot of Western traditions, which was fun.
Yes, 100%. And both your parents were doctors. So
Yes, that's
you
fun.
followed in their footsteps. And I mean, I have to say, you're like any Indian parent's model child, because not only did you earn, your degree in medicine, you have an MBA from Wharton too. You're just knocking it out of the park now.
No, actually, when I was going to start business school, my parents said, "Do you really need to go to school for this long? Look at how old you're getting." So
No, but it's amazing how you knew you wanted to change and wanted to pivot. But let's start from your work as an internist. Did you always know you wanted to be a doctor?
I did. I can't remember a time where I did not know that I wanted to be a doctor. I was just intellectually, I found medicine very intriguing. So I always did know that I wanted to go into medicine. Again, the whole aspect of helping people, if you ask any doctor why they do what they do, it's because they thoroughly enjoy helping people. Now, of course, at the time, I never thought that aesthetics would be any part of that because there wasn't such a thing. When you become a doctor, your perspective on how to help people continues to evolve. And I think that's how I got into aesthetics, actually.
What kind of was the inspiration behind you starting your own med spas and skincare line?
So when I was practicing as an internist, I'd worked in clinics, I had worked in the hospital. I personally always enjoyed beauty and skincare. And I also struggled with acne scarring. And when I was growing up, there weren't many products in general. At the time, I did not even have the concept of looking for products for my skin tone. It just didn't even occur to me because we never saw that as at the time, marketing wasn't as diverse. So when I was looking for solutions for myself, I recognized how frustrating it can be. And I was going to see dermatologists who were also women of color, just like me, same skin tone. And it was very clear that there isn't enough information. And I could see from the patient's perspective how frustrating it got. And also I got a little, I would say, burnt out from the traditional practice of medicine, because in a lot of ways, I didn't always feel like my patients left the office happy. The concept of med spas had, there were quite a few med spas, and I had started visiting them. And I thought, well, this would be a wonderful way to practice medicine and also continue to explore things that I'm interested in, which was medical aesthetics. The first thing I always ask a patient when I see them is, what skincare are you using? And it was very interesting to see some really common trends among women of South Asian descent. There were women who had tried a lot of different medical grade lines, some more aggressive lines, and they just felt that their skin was always kind of angry. They just weren't spending a lot of money and putting time into it, but they weren't getting where they wanted to be. And then there were people who had done that, or maybe not, and they were using essentially baby skincare, Cetaphil, CeraVe, and I have nothing against those lines. It's just that you can temporarily use them, but you're not getting any active ingredients that can actually help your skin rejuvenate. So it was very clear that there was a lot of confusion in that area. And I think that's really what inspired me.
We all know that the skin is the largest organ of the body, and the skin and its derivatives, so it's our hair, nails, sweat, and oil glands. That's what makes up what I learned, the integumentary system. And one of the main functions is protection. It's like a misnomer to think skincare is part of beauty. It's actually a necessity because it's how we can protect ourselves from, outside agents and bacteria and chemicals, right?
Exactly. And that's actually where a lot of the frustrations and bad experiments happen on South Asian skin, because or excess or abnormal pigmentation is our biggest problem. But we're so lucky that we have the kind of melanin that we do. So there are two types of melanin. When you have a darker skin tone, you have more of something called eumelanin. And eumelanin is very effective at blocking the collagen damaging effects of UV radiation. to do that, you create more pigment. And if there's any inflammation or breakage in skin, the skin tries to protect you and creates more pigmentation. So a lot of the skincare practices or beauty practices for women or people of South Asian, East Asian descent come from blocking melanin production or breaking melanin. That may mean using acids or things that actually increase inflammation or break the skin barrier. So it is fighting the skin's defensive mechanisms. Bleaching creams or creams that are only directed at melanin reduction don't support all the other excellent things that your skin has to provide for you. In my skincare line, that's one of the big things is I do educate people about using a system of skincare. One product's not going to do it all, unfortunately, just because, you're expecting this 1 or 2 drops of one product to deliver all these active ingredients into your skin and do all these functions. And up to now, we don't have one that does that.
Right. I love that you brought this up because we grew up in a culture where we all know what Fair and Lovely is. And, brightening, bleaching, this fairness cream industry is actually an $8 billion industry. In fact, a friend of mine, Nina Davaluri, who was a former Miss America, she's joining me on the show in a few months. She did a whole documentary on this called Complexion. It hits so close to home. I think it's so important that you shed light on how these melanin blockers are actually counterintuitive and they make your skin go into like a melanin overdrive. And so It's not healthy.
No, it's not. And going back to when we were growing up, my grandmother would visit us periodically. She would be floored to see what happens to us when we spend time around a swimming pool. And but
they're like, don't get dark.
That's right. But using skin bleaches or really harsh exfoliants is something that a lot of people of color are marketed to do. And that's when you see the excess pigmentation, the unevenness, the dullness, and skin just your skin literally doesn't feel happy.
Yeah. And I think, we have to be mindful that it's not that innocuous because I remember, this takes it back, but I was in like 5th or 6th grade and being Indian, I think, we also, many of us are hairy and our hair shows. And so it's like the eyebrows, the upper lip, like we got to deal with it. My mom, I convinced her, I said, okay, if I'm not allowed to wax because I'm too young for that, like at least I can do Jolin. And I used Jolin facial bleach to bleach the facial hair and peach fuzz. I remember in salons that we would go to, they were like, oh, do you want to just have me apply this entire Jolin bleach on your face or this Shahnaz bleach on your face? And I thought, fine, what's the big deal? I feel like that's something that we can touch on too, that like, it's not just the creams. Sometimes we use a bleach as a means for covering up hair and hair, not removal, but and that's not good either.
No, it's not. The way bleach works is it's an acid, it's hypochlorite acid, and its job is to dissolve things. So it dissolves our skin barrier. So the superficial layer of our skin, the epidermis, which houses our pigment producing cells, just goes, oh my God, I need to produce more pigment. I need to immediately protect the skin. So it does the opposite. Then the skin will turn it won't even turn darker. It actually turns a darker brown, grayish,
yes.
looking, especially in patches. And that's because it's abnormal production of melanin. And bleach is so heavily used in South Asian culture.
Yeah. So then I guess as a solution to that, opt for waxing or laser, because laser technology has advanced, right? And our skin tone can handle it.
It certainly has. Laser hair removal technology has advanced so much in the last few decades. Regardless, it's important to know what laser hair removal machine you're using and the operator's experience. If you walk into a laser hair removal clinic and everyone sitting in the waiting room is not your skin tone, then, you need to ask them what their experience is with your skin type and tone, because it does make a difference. And laser hair removal, yes, very gentle on the skin. And honestly, waxing is actually quite safe. Threading is quite safe. But if you were to wax continuously, you're just you're just pulling on your skin so much. And there are people who, even after threading or waxing, will break out. You don't ever see that with laser. So it's a very safe way. It's an investment, but certainly something that can easily be done.
Yes, we've come a long way. I mean, I remember back in the day, it was either creams, waxing, threading, and then electrolysis. I don't think anyone does electrolysis as commonly now.
No, it's because it's pretty labor intensive and it can be painful unless they have things like polycystic ovarian syndrome and they're just not responding, then yes. But I would say 99% of the people doing any kind of hair removal with a device or laser.
For the millennials who are listening, I think the majority of us have been prescribed some sort of oral medication when we had acne in our teens or maybe even adult years. I know I've personally been on Accutane and I know so many people who have. What are your thoughts on Accutane?
Well, I do think that Accutane is very powerful. However, your skin is going to get really dry. And I see a lot of young kids and men and women who are prescribed Accutane, but they're not given any guidance on skincare, or they're asked to use skincare that maybe is a little too occlusive on the skin. So it's petroleum jelly or Vaseline. And so I think that Accutane, along with good hydrating, lipid-rich skincare, is excellent. But if you have less severe acne, there are other things that monthly facials with a medical grade facialist and proper skincare makes such a big difference.
Yes, 100%. And now I wanted to have like a personal consult, if you will.
Of course.
I'm so excited for this. I've been doing peels for a very, very long time. Since my 20s. I feel like right out of college is when I started doing microdermabrasion or just a variety of peels. And I want to share one scenario that was pretty recent. It was March of 2020, and we had just embarked on lockdown and didn't even know what it was. So I was like, yay, I have 2 weeks off. And a friend who is an esthetician, I called her up and I said, can you send me an at-home peel that I can do? So I tried the Perfect Derma Peel. I essentially burned my skin off and had given myself hyperpigmentation. And I feel like many of us have made these fumbles because you just want to do it on your own. And it turns into this botched experience. And you're like, oh my God, why did I do that? But afterwards, I met with a local dermatologist, Dr. Janine Downey, who gave me Cispera. And before that, like a concoction of hydroquinone for a couple weeks. And then that made everything subside. For many of us, hyperpigmentation is like our number one concern. And maybe a close second is like the residual acne scars. And that's what I have. So what would you say is a good treatment plan for?
Yes. So let's just start with like something everyone can do, which is skincare. So hydroquinone has been around for a while, and hydroquinone essentially is a pharmaceutical and it reduces melanin production. But the only problem is that you can't use it indefinitely. You can only use hydroquinone for a short period of time, and then you have to stop using it. When you're trying to clear hyperpigmentation, the thing that's most important, honestly, is building back your skin barrier. And retinol actually is an excellent way to increase your skin cell turnover to erase pigmentation, and it'll also help your skin barrier. But if you've used retinol in the past or tretinoin, you probably remember that it makes your skin get very dry and you're just flaking all the time. And the skin may also look kind of uneven and dull. That's actually what inspired me to create my retinol. It's a medium grade, 0.5% retinol, but it is combined with lipids. So when you apply it, it actually looks like an oil. That is going to help build your skin barrier while you're doing all that skin cell turnover, so you can actually use it and not look uneven. But retinol is a great way to reduce pigmentation. The other thing is maybe also using some chemical exfoliants like glycolic acid and lactic acid, but not every day. So a few times a week. That also kind of helps slough off dullness. And then last but not least, having more botanical skin calming or lightening agents. And when I say lightening, they reduce abnormal melanocyte production, not going into overdrive. So things like bearberry extract, arbutin, tranexamic acid, we're seeing that more in skincare now, azelaic acid. These are all sort of kojic acid. These are all botanicals that help with just sort of evening out pigmentation.
What about from a procedure standpoint? Do you go for peels? Do you go for laser?
I generally don't like peels very much, just because in our skin tone, if you want a lot of results from peels, then you're not going to be able to use the very deep peels, which are, usually have, the perfect derma peel that you were talking about has some phenols in it. So peels, I would consider something that you would use for just sort of light maintenance. But for more results like acne scar reduction, anti-aging, pigment reduction, post-inflammatory hyperpigmentation reduction, I like to use microneedling or PicoSure laser. And when I say PicoSure laser, I'm specifically pointed out because, as you know, you've done a few laser treatments before. There's so many lasers in the industry. They have different brand names. They're different device categories, and it's really confusing. Yeah. And there are some lasers that are just very dangerous for our skin tone. So when I talk on my podcast or educate any patients, I always specifically talk about PicoSure laser, which is a picosecond laser. Our melanocytes like to protect us. So when the skin is treated with heat or light, which is what traditionally lasers emit, our skin's response is to create more melanin to protect it. PicoSure lasers or picosecond lasers are different because they emit energy and it goes through your skin so fast that it doesn't have the time to turn into heat or light. And it uses vibrational pressure waves to break your dermis, which is where you build all your collagen. So it kind of blasts it, which triggers a response of building new skin, new collagen. So it's safely entering your skin, not exposing it to heat or light, and it's creating a controlled injury for you to make new skin. So it's an excellent solution for acne scar reduction, pigmentation reduction, fine lines, wrinkles, and I use it extensively in all three offices.
How do we know that it is PicoSure wherever we are? Because, some of the med spas that I've been to, they have Fraxel, fractional CO2, intracell, like you said, it's just this whole, you're lost in all the different brand names. And it's like, this one's from Europe and this one's local. And just, it's so confusing.
No, it is really confusing. So I'm so glad you asked that. And there's knockoffs, there are places that will say they have PicoSure laser, and yet it's that's not what it is.
Yeah.
But if you ever want to check to see if a laser the provider actually has the laser you are interested in. So for example, PicoSure, go to picosure.com and there'll be a button there that says find a provider. And put in your zip code or the zip code that you're in, and you should see your provider's clinic pop up in that list. So then you know that they actually have the laser that they're advertising.
Okay, and when we go into a med spa, especially if we are BIPOC and a person of color, what should we ask the med spa estheticians during our consultation?
How many people with my skin tone do you treat? Have you treated this particular condition for people with my skin tone? And of course, ask for some before and afters, follow them on their social media, look at, what kind of pictures they're posting, because, there are providers who have PicoSure laser, but they only have the vast majority of their client base is skin type 1 through 3. And they're probably seeing a lot more fine lines, wrinkles, versus someone who is largely seeing people of South, East Asian, Hispanic, African American descent. They're going to have, with the same device, a completely different experience.
Yes. You know what? I did make a call this week to a med spa I go to, and I asked them if they had this laser. And they said, "Oh, are you calling for tattoo removal?" It's like, no.
Yeah. So PicoSure also does tattoo removal. It's a different lens that is used for that. And that might mean that they use it heavily for tattoo removal, but not as much for skin rejuvenation.
And tell us roughly what is the cost and how many sessions?
So roughly, PicoSure laser can cost anywhere from $750 to $1,000 per session. In my practice, we charge $850. If you come in and you say, hey, I am looking to reduce pigmentation from old acne scars, I will always start you on a series of at least 4 sessions. They're spread 1 month apart each. And that's because when you look at all the clinical trials for PicoSure, you'll see that patients have gone through anywhere from 4 to 6 sessions. But I found that 4 sessions seems to be a nice sweet spot where we can really start seeing full turnover of your skin. With each session, think of it as 25% of your skin is turning to new skin. But these changes are happening at the dermis, so in your deeper layer. So when you cycle through a full 4 session series, you literally have a new layer of skin. And now we know, okay, what your response has been and what we can now continue to do or maintain with.
That's so interesting. I love it. And then the downtime is just a few days or?
No, actually, PicoSure is very easy to do. And so it's something like microneedling too. You're going to be a little pink right after the procedure. And literally within the first 30 minutes, that's going to calm down significantly. And you're going to look like you had a little bit of a sunburn. The next day or two, your skin is going to look a tad bit uneven. You will probably notice it, but people around you won't. A few days later, you'll wake up in the morning and you're going to look at your skin and it's going to feel nice and smooth and very bright. So it has literally no downtime.
I can't wait to try.
I've met a lot of people who've done Clear and Brilliant, Fraxel lasers. And when they try the PicoSure, they're really surprised.
Oh, that's amazing. And then now if we can talk about acne prone skin and teens and how, you kind of help medicate them when they have hormonal or cystic acne.
I had acne as a teenager and even as an early college student, and they would always say, oh, just leave it alone. It's going to go away.
Right.
Well, yeah, eventually it will go away, but it will leave behind some really stubborn scarring and pigmentation, right? So I really encourage parents to step away from that mindset because there are so many things you can do now to address acne early so that your children don't have acne scarring and post-inflammatory hyperpigmentation. The hormonal changes we can't change very much because, of course, when kids are going through puberty, they are going through these huge hormonal changes. But I think one thing is that it is hard for them to stick to a regimen. So what I found that's very effective for not only my children, but I see actually quite a few teenagers in my practice is take them to an esthetician, a medical grade esthetician who usually will be in a medical spa, get them on a regimen of monthly facials. She will likely be very good at educating them about use of skincare. Starting retinol at an early age is very, very safe and it's very effective. But again, retinol increases skin cell turnover. So getting them into a facialist every month to do a microdermabrasion, really get that extra dead skin off their skin, also extract and things like that. Excellent thing to start, in your teens as early as 13 or 12, whenever your child is starting to show acne. And again, retinol can be safely used. Oral, Accutane is a consideration really if it's more severe acne. And again, sunblock, a lot of kids don't use sunblock or think that it's cumbersome, but it does save your skin from the extra post-inflammatory hyperpigmentation that you get with acne, especially in our skin tone.
Right. What's your take on girls taking birth control to kind of manage?
I would say birth control is really only effective if they have a lot of acne and irregular periods.
Yeah.
Girls, if girls have pretty regular periods, or they've taken birth control for irregular periods, but their acne and excess hair growth are still not responding, then I prefer using a medication called spironolactone. And spironolactone is a medication that we normally use for heart health. But what it does, it just lowers the amount of testosterone that the body is producing. And it is very effective in controlling hormonal acne. So I actually usually will go to that first if the patient is not experiencing irregularities in her periods. Mm-hmm. Birth control tends to, I find birth control is not the best at acne control, honestly. It's better at correcting your periods and cycles.
Yeah, I love that you say that because sure, it's a nice supplement if necessary, but like, let's use the medication for what its, primary problem that it's solving.
Right. And it's not something that they have to be on for exactly. Like, let's use the right medication for the problem. And they don't have to be on it for the rest of their life. These hormonal surges they're having are temporary also. So typically what I will try and do is let's use your spironolactone for like a year and a half, then take you off of it and see how you're doing. Now, in that year and a half, though, let's start doing your facials, use proper skincare, really just build your skin back. And then you can kind of successfully get off that spironolactone as well.
That makes sense. Great. And now let's do some myth busting. Should we be using retinol starting in our 20s?
Oh, absolutely. I think retinol is one of the best inventions in aesthetics, and it can be safely used in your 20s and your teens and onwards, and indefinitely for the rest of your life. I can, at this point in my practice, I can look at a person for the first time, and if I look at their age and I look at their face, I can tell that they've used retinol. It makes such a difference.
Oh, I love that. And then I guess barring pregnancies, that's the only time you should be. But what is the difference between a retinol versus a retinoid?
Retinoid is sort of the category of vitamin A derivatives. And retinol, tretinoin are the most commonly used ones. Retinol is actually a precursor to tretinoin. So that's why it's not as strong when, you apply to the skin, but that doesn't mean that it's not doing the same thing tretinoin is doing. So that's usually a misconception. A lot of people think that they should be on tretinoin or 1% tretinoin because it's making them peel. So it's definitely doing a much better job. Retinol will convert to tretinoin in your skin, and it'll save you from all that inflammation that tretinoin typically causes. You don't have to experience that unhappy 6 to 8 weeks of retinol usage to get effect from it. A lot of studies have been done that have compared retinol versus tretinoin, the 0.5% versus 1% and all of that. And the effects are actually the same, minus the inflammation.
That's great. Yeah, I remember you saying that on the skin report that 0.5 is enough.
Absolutely.
That's great. And what about cleansing brushes like a Clarisonic? Is it too abrasive or is it okay?
I actually am not a fan of the Clarisonic or any cleansing brushes or cleansing towels. That mechanical abrasion that happens with a cleansing brush, especially if you do it a few times a week or every day, can just be too aggressive on your skin barrier. It'll physically create micro tears. So instead, using a cleanser that has maybe a light chemical exfoliant or just very light particles, tiny particles, is a lot gentler and effective. And it actually really gets into your pores, right? Your pores are so microscopic. The bristles of the brush honestly can't even really get into them. You are better off not using one. Or if you have one, maybe use it once a week.
Yes, I'm with you. I feel like I've spoken to another dermatologist about that, and she said it results in broken capillaries. Just no. What about your take on dermaplaning?
I like dermaplaning. I think that dermaplaning is a very safe way to just sort of, kind of polish the skin, because your dermaplaning is essentially a more glorified way of shaving your face. But on a more regular basis, you can really, minus the hair removal, your skin can look very polished if you use every other night or something, a mechanical exfoliant. like something that has small particles. So, you don't necessarily have to be comfortable with dermaplaning. I think dermaplaning's effects are mostly related to removing the peach fuzz from your face. But it's safe, it's effective, so I have nothing against it.
What about derma rolling?
It's such a TikTok and Instagram hit, but I think it is so dangerous for the skin. A derma roller looks like a lint roller with spikes on it. And what they're trying to do is make little breaks in your skin to induce collagen production. But your collagen production happens in your dermis, which is very deep. And to enter your dermis, you have to break your skin barrier, get into your epidermis where we make our pigment. They can't get to the dermis because to get into our dermis, it's very painful. So you can't possibly afflict that level of pain on your skin with a derma roller. These little spikes go into your epidermis where they do, guess what? They will make your melanin go crazy. And so we have such an increased chance of post-inflammatory hyperpigmentation and scarring that happens with a derma roller. Instead, go into a medical professional, get a proper microneedling procedure done. So much more effective and safe.
And tell us about that. I mean, the Kardashians made the vampire facial, just kind of go viral. What is it about microneedling? Is it legit?
It totally is. And, some of our earliest studies from microneedling that are decades old, they actually come from Africa. Excellent and safe choices for skin of color. But microneedling essentially makes controlled breaks or injuries into the skin to induce collagen production. So, it's just stimulating collagen production, but it's doing it in a controlled fashion where it's not going to make your skin make that extra imbalanced amount of melanin. And the vampire facial, where you do a microneedling procedure, but then you draw the person's blood and spin it in a centrifuge to isolate your plasma, which is very rich in growth factors, and apply it into the skin. That just sort of ramps up the collagen building effect. And it actually also helps quieten down your pigment producing cells. So it's a great treatment.
Yeah, no, I've done it before and I love it. And it makes sense. It's the platelet rich plasma, PRP, which just helps heal the skin because it does.
It concentrates all your growth factors and delivers them into your dermis.
Exactly. And now let's dive into your skin line, which is so exciting. Congratulations on launching that.
Oh, thank you. It's something I'm very passionate about. And I'm fortunate that I had the years of experience working with people with my skin tone and skin issues to be able to sort of develop it.
So tell us about, the range of products to start.
I have cleansers, some exfoliants, serums, sunblock, but I also have a retinol in it. And one of the things about skincare is that it's very overwhelming. And one thing I learned from my own journey and looking at what my children buy, because of course they are always on TikTok and they're always using my credit card to buy skincare from other lines.
Oh, get out. I can't believe that.
But then if it doesn't work, they always offer it to me too. So I think that's really sweet. I'm like, okay, thanks. I will use your teenage cleansing cream. Sure.
Right.
But there's a lot of duplication in our steps. It's very common to see someone using a cleanser, which has an exfoliant in it, and then they're putting another exfoliant on top of that. Then they're going and putting, moisturizer on which has sunblock in it, but not enough sunblock, so there's a lot of this going on. So my skincare line is really, you can, of course, buy products individually, but I also have little sets for different skin concerns. And I have little trios and duos that you can easily incorporate. I have a set for acne, Crohn's skin, one for just brightening the skin, which is more for normal skin, a set for dry skin, and then the signature system, which is actually what I use. So it has a few more steps, but it's a system that's great for brightening the skin, but also anti-aging.
That's excellent. And could you give us, an ideal morning routine and evening routine with your products? Because one thing that I was surprised to know is that we can use vitamin C during the day and night just under your sunblock. I feel like once you explain this, it'll be enlightening for us what we actually have to do as far as steps in our morning and evening routine.
So basically our skin care steps have to follow our skin renewal cycle. And the morning routine is going to look a little different than the evening routine. But the first thing is you should always wash your face in the morning with a cleanser. There's a trend to not use a cleanser and just wash with water. And I know usually people tend to do that if they have dry skin. But at night, we're actively building all the cells in our body, including our skin. So when we wake up, we actually have a layer of sort of like dead old skin sitting on our skin that we do need to wash off. So now you washed off all that debris, dead skin cells of your skin. So now your skin is ready to take in all the good stuff. So the active ingredients. So a serum with some sort of antioxidant. So my vitamin C serum is actually a THD vitamin C. It's not an L-ascorbic acid vitamin C, which means it's not acidic. So, it doesn't feel like you're putting a lemon on your face, which if you've used a 20% L-ascorbic acid, you may have experienced. And it is 8 times stronger than a 20% L-ascorbic acid, but it's not acidic. So it matches our skin's pH. But anyway, an antioxidant serum. So cleanse, antioxidant serum. So vitamin C is one of them. I also have a vitamin E and a green tea serum, depending on your skin concern. And then after that, a moisturizer. Moisturizer is great for any skin type. But if you have greasy skin, then, I know sometimes people get a little, wary of putting moisturizer on, but you can safely put a hydrating moisturizer on. And if you have dry skin, there are more lipid-rich moisturizers that you can use. And then after that, this is an important step that I think a lot of people don't recognize is that we're warm-bodied, so we're constantly losing our moisture. Think about when you wear a moisturizer and then just a few hours later, don't you feel like your skin's dry again?
Yeah.
Or if you have oily skin, you washed your skin, you put a serum on, and then literally a few hours later, your skin is oily all over again.
Yeah, your T-zone's like shimmering again.
Yep, exactly. And that's because we're just losing all this water and moisture in the air because we're warmer than our environment. And in oily skin, we're doing the same, but oil producers then will counteract that by just making more oil. So the way to balance oil production and not to lose the moisture from your skin if you have dry or normal skin is to apply a hyaluronic acid serum above your regular moisturizer. So my hyaluronic acid serum is actually in all the skincare sets because it's a combination of not only hyaluronic acid, but something called snow mushroom extract, which is actually even stronger than hyaluronic acid. And its job is essentially to just nicely block that moisture. So your skin looks really balanced and it looks dewy and plump, not oily or dry.
That's excellent. And do you have a favorite product? I know it's hard to choose, but maybe one that's like, oh my God, I'm low on this because I use it all the time.
I would say my favorite product is our retinol. It just sinks into your skin and your skin just looks dewy and plump. And a lot of my patients will tell me that, I applied this retinol and the next day my skin looked so vibrant. And I'm sure it's not really the retinol acting that fast. It's probably the lipids in it, but I would say that's my favorite.
And now I want to switch gears and talk a little bit about your parenting journey. You are a mom of 3. What was your motherhood experience like, when you had your first?
My first child, my daughter, was born 4 months before I started medical school. Yes. And the saying, it takes a village to raise your kids. So I was very fortunate because I had to really rely on this village. My mother-in-law, my father-in-law, my sister, my parents, they all did so much to allow us to be able to, because my husband was actually a surgery resident when I was a medical student. So we had no money and time.
And had this baby.
And we had this baby. Yeah. But you know what? I think that for any mother, I don't think there's ever honestly like a best time to have your children. And no matter what, you make it happen and you make it work. But I will say that when I had my children, I was always rush. And until I had my third one, I actually had my third daughter when I was in residency, and I took a one year break because I just felt like with my other two, I just felt like time had it just flew, and I just never had a chance to kind of enjoy them as much.
Yeah.
So I'm so happy that I was able to do that. And because when people tell you enjoy them when they're little, they're not lying.
Yes, it's true. It's true. And I'm so glad you gave yourself that pause.
It's very difficult to do that because you always think that you're going to miss out on something if you take that pause in your career, but that's not true.
Yes, no, absolutely. And then what about your other two? Kind of what phase of life were you in when you had them?
So my kids are very used to going to activities or play date or a pediatrician's office where I have a book with me because I'm studying for boards or I'm studying for the test or this. But, I feel like they were like my companions on that journey. And some habits have been instilled into them. We've learned efficiency. So I think looking back, I wouldn't have it any other way. And honestly, I don't think our lives are any busier when we're out of school either. So you just learn to become more efficient when you have your kids, no matter if you're a student or you have a career already.
And what do you admire most about them? I'm sure they all have taught you along the way too.
They have. I think my oldest, I do admire how calm she can be in every situation. And she's always very positive. So I really admire that about her. And my son, I would say, is more like me. He really has a big heart and he's sandwiched in between two girls. No matter what he does, he's wrong.
Yes. Yeah.
But he tolerates them, which I really do admire because I don't know if I could if I was him.
Yeah, girls are a lot.
They are. They're a good mix of kind and conniving because they'll at the end of the day they'll make you do what they want you to do. And then the younger one, she's fun. She's quite the hybrid of the two. It's very interesting to also see parts of your personality and your husband's personality in your children as they grow.
Oh, I find that so fascinating. I mean, they're like a mirror to us sometimes. Yes. And you're like, oh my God, I can see myself doing that when I was a kid.
Yep, exactly.
Tell us about a mom sense moment you had. And this is something I love to ask all my guests, where it's a time where you trusted your intuition, that sixth sense that we have, and said, this is what I feel is the right thing to do.
When my oldest was making decisions about which college she should go to, that she had the option of going to a lot more higher ranking college on the East Coast, but we live on the West Coast, or one that was not ranked as high, but was in California, in LA, and we're in the San Francisco area. And all her friends told her counselor told her, oh, obviously you should go to the one that's higher ranked. But just knowing her and how attached she was to her siblings and her family, and just when we took her and how she was interacting on the campus at the visit, we told her just, forget what everybody says and what the US News and World Report says. You should go to the school that's you. She thrived there. So, and I've seen some friends of hers and my other children, do the opposite. And sometimes it doesn't work for them. So I think there's so much external noise. And you have to just see what's right for your child, forget rankings, and let them do what's comfortable for them and grow at the rate that is comfortable for them also. That's
beautiful. I'm getting choked up thinking about it because I can't imagine my kids in college right now.
I know.
But yeah, I think it's so important because they are their own individuals with their own drive and aspirations, and how can we steer them in a direction? They already know where they need to be.
And if they take some time to figure it out, it's okay. When you go to a social event and all your friends and your parents and your uncles and aunts are asking you what your child is majoring in or where they're going to school. And sometimes, those insecurities that we have, well, not sometimes, all the time, will be very visible to your child.
Yes.
Yeah. So you as a parent also have to be very cognizant of that and just, support them all the way.
Is there a quote that you live by?
There's a quote by Pele, which was, while you're pursuing perfection, you'll still achieve greatness. It's nice to be perfect, but probably impossible to
It's
achieve.
unattainable too. Yeah.
Exactly. But, if you try it, you will still be excellent. And that's great. So I tell that to my kids when I ask them why they cannot make their bed in the morning. But
Yes. Oh, that's wonderful. And lastly, where can my listeners find you, your Medi Spas, your line?
yeah, so there's a few ways of finding me. Of course, if you are on Instagram, you can find me on Skin by Dr. Sethi or RenewMD Wellness _beauty. And then the Skin Report. I also have a podcast, which is called the Skin Report. Of course, it's available on Spotify, Apple, wherever you normally listen to podcasts. And if you're interested in medical spa treatments, even if you're not in the Bay Area and just want to learn about what are safe treatments, if you're a person of South Asian or East Asian descent, go to renewmdwellness.com. And I write a lot of blogs and every treatment we do in our offices is curated for our skin tone. So if you're just trying to get educated about those things, check out our website.
Thank you, Dr. Sethi. You're extraordinary. And I'm so glad we had this chat today.
Thank you.
Isn't Dr. Simran Sethi just incredible? I love how she gave such tangible takeaways for us. And it was something that really resonated because she too is of South Asian descent and a person of color. And I've been on my own personal journey trying to find the best treatments and products and knowing which ingredients are safe for my melanated skin. And she put all of my fears at ease and explained everything so well. So I hope you enjoyed this episode as much as I did. Dr. Sethi is extending the audience an exclusive offer. Use my code MOMSENSE20 when you log on to her website, Skin by Dr. Sethi, SETHI.com, and you'll receive 20% off your purchase. So that's MOMSENSE20. Thank you so much, Dr. Sethi. I am loving my signature skincare line and the retinol. It really does wonders on the skin. And as you said, you can start retinols in your teens if need be. And it's something that can really carry you through, barring your pregnancies and nursing. But I am loving it. As always, you can subscribe and rate and review That's Total Mom Sense wherever you listen to podcasts. We are everywhere. And your reviews and feedback really help with the algorithms. And I love hearing from you. So definitely do that if you haven't already. And you can email me at thatstotalmomsense@gmail.com. We read every single email and are so glad to have you in our tribe. Dr. Sethi and I did an IG Live after show. So check that conversation out too. It's different from what we did in the interview. And we talked about Ayurveda and nutrition, like should I be eating fried food and does that contribute to acne? So if you're curious about that, just visit my Instagram handle at Kanika Chadda Gupta. You can write to me at thatstotalmomsense@gmail.com. We reply to all your messages and are just thrilled to see you in our inbox. As always, trust your mom sense and dad sense. Stay strong, super parents. I'll see you next time.